Hi, I'm Magdalena Chavez from Healthcare Associates of Texas in the Bedford office, and today we're going to talk about the ABCDEs, not the ones you learned in kindergarten. We're talking about abnormal moles. So let's jump right in. A stands for asymmetry. So any mole that looks different on one side than the other, that's generally not a good sign. Or if it looks more like a continent than a circle, that needs to get checked out. B stands for border. So if the edge is nice and firm and smooth, that's regular. Anything other than that, if it's a squiggly line or something kind of hazy, that also needs to get checked out. C stands for color. So if you have a lot of moles, you probably noticed that several of them are the same shade of brown, more or less. If you have one that looks really different from the rest, or if you have any one mole that incorporates several different shades of brown within it, that needs to get checked out. Or any shade that's a little bit more like purple or red or black than a brown, that should be looked at. D stands for diameter. So we're looking for anything bigger than 6 millimeters, which is about the size of a pencil eraser. E stands for evolution, which means that any mole that's changing, generally with one of the things we've mentioned above, whether it's a mole you've had all your life as far as you know, or at least a really, really long time, but suddenly it looks a little bigger than it was, or is darker in color, that should be looked at. Generally, any one of these can be a warning sign that a mole is more than a mole, possibly a precancer or a cancerous lesion, but especially if you have a spot that has 2 or more of the things I just mentioned, you should have that checked out by your primary care physician or dermatologist.